Hello, everyone. We are just waiting for everyone to come in from the waiting room. That should be done in a second. All right, I think we are good to go. A reminder to everyone, all participants, that this is for press only. You need to change your login name, please, to indicate your media affiliation. You can do that by mousing over your name, clicking the word more, and then choosing rename. And you'll be able to use the raise your hand function. So good afternoon again, and thank you for joining the daily briefing of the City of Philadelphia's response to COVID-19. Today, all the speakers are joining us virtually to adhere to social distancing guidelines, and we will begin our briefing with opening remarks from the mayor. Mayor Kenny.
Well, good afternoon, everyone. As our city continues to battle the COVID-19 pandemic here in Philadelphia, we have begun to start planning for what recovery looks like into the future. I recently sent a letter to Speaker Pelosi and members of Congress with ways they can help Philadelphia and other cities rebound from the economic impacts of COVID-19. As Congress considers a fourth COVID-19 response package, we need the federal government to provide support in additional ways. We need direct and flexible funding. The two most effective forms of relief that can be offered to local governments are providing direct, flexible funding and replacing lost revenue from this crisis. Without this, we will be forced to make drastic cuts, which will deprive residents of needed services, exacerbate the damage to our local economies, and lessen the possibility of a speedy economic recovery. We also still need personal protective equipment and supplies. Federal authorities have indicated that the greater Philadelphia region is at risk of a surge of COVID-19 infections. That is why we urgently requested personal protective equipment and resources to expand rapid testing capacity. We also need housing support. Nearly 300,000 Philadelphia households face housing instability. The COVID-19 health crisis has magnified the housing need, with low-income renters facing eviction and homeowners facing mortgage payment crises. You're asking for rental assistance for low-income people and people with disabilities, mortgage leniency, drinking water and wastewater assistance programs, and other measures to protect renters and homeowners alike. The government also needs to support our most vulnerable. We need additional resources to meet the basic needs of those who are the most vulnerable. We ask Congress to increase support for Medicaid, SNAP, and TANF, as well as provide flexible emergency assistance for homeless services and increase support for unemployment programs. And we also cannot forget about education. We need more than the CARES Act to stabilize education and to close the gap in learning due to schools and institutions being physically closed. Comprehensive education solutions include immediate and long-term investments in early childhood education, K-12, and higher education. We also need federal support of job training and retraining to help the many adults who will lose their jobs and need support to improve their education and skill sets. Our letter also asks for additional small business relief, vigorous support to small businesses, including the need to significantly expand the economic interventions from the first three coronavirus packages. Our requests include business disruption insurance, increased funding for the SBA payroll protection program, an employee retention tax credit, emergency family medical leave, emergency paid sick days program, paid leave tax credits, loans and grants, and direct aid to airports. We also need to make sure we have fair elections. Pennsylvania recently established universal vote by mail ballots, which will be available for the first time in the upcoming primary election that, as you know, has been moved until June. The system will be critical to reduce the risk of virus spread. At the same time, social distancing will make education and outreach efforts much more difficult, and voters without internet access will need additional support. Philadelphia needs more funding to ensure that everyone can exercise their right to vote in the upcoming election and elections going forward. And finally, we need to see pension relief in the form of funding for state and local pension funds. Philadelphia has made significant progress on our pension reform plan and strengthening our pension fund. However, the sudden downturn in the markets in March led to substantial losses for public pension funds nationwide. We thank Speaker Pelosi and members of Congress for acknowledging the receipt of this letter, and we look forward to working with them all on all these important issues moving forward. In the meantime, we continue to fight the spread of the virus. The city's Emergency Operations Center, coordinated by the Office of Emergency Management, will expand its operations to 24/7 starting tonight. The EOC was activated March 11th, connecting over 25 agencies for 16 hours a day to support key city operations, public safety, public health initiatives, healthcare operations, and public information. Philadelphia Police, Fire, and OEM's Regional Integration Center had been active 24/7 since the very beginning. The EOC is now increasing capacity for two main reasons. The first is to manage operations of our response-related sites. The second is to manage operations of the Leah Core Center as it becomes closer to being operational and taking on patients if necessary. The Emergency Operations Center serves as the nexus to the city's COVID-19 operation, connecting the city's response to the Unified Command Group and all the stakeholders. The EOC is physically staffed with a third of the personnel who would usually be in the room to promote social distancing as others work remotely. Its expansion to operate 24 hours a day means that we have even more resources overnight to respond to COVID coordination issues. I want to again thank all the city employees who are working around the clock as we continue to fight the spread of COVID-19. I also want to remind everyone that today's meal and food box pickup were delayed due to the severe weather. We didn't want to put anyone at risk standing outside in these conditions. Meals and food boxes will be available tomorrow, Tuesday, April 14th, and again on Thursday, April 16th. I know there are many families relying on these sites, so we appreciate the media's help in getting this change out to the public. We'll return to the regular Monday and Thursday distribution schedules next week. As always, we encourage folks to visit phila.gov/COVID-19. That's phila.gov/COVID-19 to see a list of locations for the city's food sites and the school district student meal distribution sites. Last Friday, we announced that the deadline to submit applications for funding from the Philadelphia COVID-19 Small Business Relief Fund is before midnight this Wednesday, April 15th. Before midnight this Wednesday, April 15th. As a reminder, applications are only open right now for the micro enterprise level, meaning businesses with annual revenue of under $500,000. The relief fund has received over 6,000 applications for more than $82 million in aid. With $12.1 million to disperse, we hope to issue funding to at least 1,000 local businesses. But we know that won't be enough. That is why our team continues to seek out additional resources from the state and federal governments. The road to recovery will not be easy, but we are committed to doing all we can to support Philadelphia businesses and its workers. Thank you. Now I will turn it over to Dr. Farley for his daily update.
Good afternoon. The health news is a little bit better today. After many days in which we've seen rises in cases of the coronavirus infection, the numbers are looking like we may be at or near the peak of the epidemic. We're seeing a stabilizing in our daily case count, and also what looks like a stabilizing in the number of cases in hospitals. Let me give you details. There are 427 new cases identified of the coronavirus infection in Philadelphia residents today, bringing us to a total of 6,813. Now, that daily count at 427 is lower than we've seen in the past few days, but not all of our laboratories report to us over the weekend, and I don't believe we've received all the backlog yet. So we may see an increase tomorrow just as they're clearing out the backlog. But the overall trend is the same or perhaps a little bit down, which is a sign of hope. So for all of those of you who are staying at home and following the stay-at-home order, give yourself some credit for protecting yourselves and each other. The numbers I'm seeing give us, I think, solid evidence that stay-at-home recommendations is working in flattening the curve and protecting people from this infection. We continue to follow the cluster of infections in the city's jail. Currently, we have 66 inmates with the infection. That includes 3 people who have newly turned positive and 5 others who have recovered. As far as our hospitals in the city, our cases are growing, but just so slightly in the past few days. In the city of Philadelphia, there are 711 patients in city hospitals with coronavirus infection. In the Philadelphia region, there are 1,289, which is just slightly higher than where we were yesterday. Those hospitals are busy, but they're able to handle those cases. Across the system, there are plenty of vacant beds and plenty of available ventilators. And our emergency departments are also not busy. In case they were to become busy, in case they were to become overloaded, we are standing up our surge facility hospital at the Leocore Center at Temple University. That is coming together very nicely, and it may be ready to accept patients by the end of this week if needed. I'm sad to report today we have 14 new deaths from the coronavirus infection, bringing us to a total of 190 since the beginning of the epidemic. Now, that number 14 is lower than we've had in past few days, and we hope that declining trend continues. Of the 190 deaths, 93 occurred in nursing home residents, and 125, or about 2/3, occurred in people over the age of 70. Now, I know there's a lot of interest in the racial breakdown of people with this infection and people who died from this infection. There's more information on that today on our website. Of those people who have died, African Americans represent 49% of the deaths, and whites represent 27% of the deaths. We have now calculated out mortality rates by race. The mortality rate among African Americans is 1.3 per 10,000, and among whites is 0.8 per 10,000. For those people who concerned they may have this infection and want to be tested is still available on a limited basis across the city. Just go to our website, phila.gov/COVID, and go under FAQ, getting tested, and you'll see links and phone numbers to all the different sites where you can get testing. So to everyone now, whether you want to have tested or not, we have good news here today, but despite the better news, it's still very important for people to be serious about staying safe. The virus is still circulating throughout the city. And if we start behaving as we have before, the virus will unquestionably surge again. We don't want that to happen. So stay home, just as before. If you have to go outside for work, for example, if you have to go to the grocery store, keep your distance from people and wear a mask. When we feel like it's safe for you to come out of your home and interact with people, we'll let you know. But for now, we're not there yet. We're just showing signs we may be stabilizing. We're not on the other side of the epidemic yet. For more information about anything having to do with the epidemic, www.phila.gov/COVID, or if you want medical questions, answered 1-800-722-7112. Thanks.
Mensaje del alcalde Jim Kenney para el lunes 13 de abril del 2020. Buenas tardes a todos. A medida que nuestra ciudad continúa luchando contra la pandemia del COVID-19, hemos comenzado a planificar nuestra recuperación hacia el futuro. Recientemente, le envié una carta a la presidenta de la Cámara de Representantes, Nancy Pelosi, y a los miembros del Congreso, sugiriendo formas de ayudar a Filadelfia y a otras ciudades a recuperarse del impacto económico del COVID-19. El Congreso está considerando un cuarto paquete de respuesta al COVID-19, pero necesitamos que el gobierno federal nos brinde apoyo de formas adicionales. Necesitamos financiamiento directo y flexible. Las dos formas más efectivas de alivio que se puede ofrecer a los gobiernos locales son el proporcionar financiamiento directo y flexible y el reemplazar los ingresos perdidos producto de esta crisis. Sin este financiamiento, nos veremos obligados a hacer recortes drásticos, lo cual privará a los residentes de los servicios necesarios y profundizará el daño a nuestras economías locales, disminuyendo la posibilidad de una pronta recuperación económica. Necesitamos equipos y suministros de protección personal. Las autoridades federales han indicado que el gran área de Filadelfia está en riesgo de un aumento de las infecciones por el COVID-19. Programas de asistencia con el agua potable y aguas residuales y otras medidas para proteger a los inquilinos y a los propietarios de viviendas. El gobierno también necesita apoyar a nuestros residentes más vulnerables. Necesitamos recursos adicionales para satisfacer sus necesidades básicas. Hemos solicitado al Congreso que aumente el apoyo a Medicaid, a SNAP y a TANF. También hemos pedido asistencia de emergencia flexible para servicios para las personas sin hogar y un mayor apoyo para los programas de desempleo. No podemos olvidarnos, sin embargo, de la educación. Necesitamos más que la ley CARES para estabilizar la educación y cerrar la brecha en el aprendizaje debido al cierre físico de las escuelas y de los institutos de enseñanza. Las soluciones educativas integrales incluyen inversiones inmediatas y a largo plazo para la educación de la primera infancia, para el kindergarten hasta el 12º grado y para la educación superior. También necesitamos el apoyo federal en materia de capacitación laboral para ayudar a muchos adultos que perderán sus empleos y que necesitan apoyo para mejorar su educación y sus destrezas laborales. Nuestra carta también solicitó ayuda adicional para apoyar a las pequeñas empresas, incluyendo la necesidad de ampliar significativamente el alcance de los primeros 3 paquetes del coronavirus. Nuestro pedido incluye seguro por interrupción de negocios, mayor financiamiento para el programa de protección de la nómina de la SBA, la Administración para la Pequeña Empresa, un crédito tributario por retención de empleados, una ley de licencia médica familiar de emergencia, un programa de días pagados de enfermedad por emergencia, créditos tributarios con licencia pagada, préstamos y subvenciones, y finalmente, ayuda directa para los aeropuertos. También debemos asegurarnos de tener elecciones justas. Pensilvania estableció recientemente las boletas universales de voto por correo, que estarán disponibles por primera vez para las próximas elecciones primarias este junio. Este sistema de votación a distancia será crítico para reducir el riesgo de propagación del virus, aunque el distanciamiento social haga más difícil los esfuerzos de educación y divulgación entre los votantes sin acceso a Internet, que van a necesitar apoyo adicional. Filadelfia necesita más fondos para garantizar que todos puedan ejercer su derecho al voto. La ciudad ha avanzado significativamente con nuestro plan de reforma de pensiones y en el fortalecimiento del fondo de pensiones. Sin embargo, la repentina recesión en los mercados en el mes de marzo resultó en pérdidas sustanciales para los fondos públicos de pensiones en todo el país. Le agradecemos a la presidenta de la Cámara de Representantes, Pelosi, y a los miembros del Congreso por recibir esta carta y esperamos trabajar con ellos en todos los temas importantes para poder seguir adelante. Mientras tanto, seguimos luchando para detener la propagación de este virus. El Centro de Operaciones de Emergencia, EOC de la ciudad, coordinado por la Oficina de Manejo de Emergencias, la OEM, ampliará sus operaciones a 24 horas, 7 días por semana a partir de esta noche. El EOC se activó el 11 de marzo, conectando a más de 25 agencias durante 16 horas al día, apoyando las operaciones claves de la ciudad, la seguridad pública, las iniciativas de salud pública, las operaciones de atención médica y la divulgación de información al público. El EOC está aumentando su capacidad por 2 razones principales. La primera es administrar las operaciones de los organismos de respuesta. El segundo motivo es administrar las operaciones del Leacure Center y atender a los pacientes si fuera necesario. El EOC cuenta con 1/3 del personal que normalmente estaría presente para promover el distanciamiento social, mientras que otros trabajan de forma remota. Quiero agradecer nuevamente a todos los trabajadores de la ciudad que han estado a las 24 horas del día luchando mientras continuamos para impedir la propagación del COVID-19. Quiero recordarles a todos que la distribución de alimentos para estudiantes y en los centros de apoyo de la ciudad se suspendió el día de hoy debido al mal tiempo. No queríamos poner a nadie en riesgo bajo estas condiciones. Los alimentos estarán disponibles mañana martes 14 de abril y nuevamente el jueves 16 de abril. Y como siempre, alentamos a las personas a visitar fila.gov/COVID-19 para ver una lista de ubicaciones en los centros de distribución de alimentos de la ciudad y de los centros de distribución de comidas para estudiantes del distrito escolar. El viernes pasado anunciamos que la fecha límite para solicitar ayuda al Fondo COVID-19 para pequeñas empresas de Filadelfia es hasta este miércoles 15 de abril a la medianoche. Como recordatorio, en este momento se reciben solicitudes solamente a nivel de la microempresa, lo que significa negocios con ingresos anuales inferiores a $500,000. El fondo de ayuda ha recibido ya más de 6,000 solicitudes por más de $82 millones en ayuda. Con $12,100,000 disponibles en este fondo, esperamos que 1,000 negocios locales reciban la ayuda que necesitan. Sabemos que esto no es suficiente y es por eso que nuestro equipo continúa buscando recursos adicionales de los gobiernos estatal y federal. El camino hacia la recuperación no será fácil, pero estamos comprometidos a hacer todo lo posible para apoyar a las empresas y a los trabajadores de Filadelfia. Juntos superaremos esta tormenta. Y esta es la actualización en materia de salud al 13 de abril del 2020. Desde ayer se han confirmado 427 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 6.813 casos en la ciudad. Los casos están aumentando lentamente. La ciudad está monitoreando muy de cerca todas estas cifras. Tenemos 3 nuevos casos de COVID-19 entre los internos, para un total de 66 casos registrados. 5 internos se están recuperando satisfactoriamente. Los hospitales están monitoreando el crecimiento de los casos. En un total de 711 pacientes que están hospitalizados en Filadelfia y 1.289 en la región sureste de Pensilvania. Los hospitales están preparados para enfrentar esta crisis. El centro de emergencias en el Diacura Center puede estar listo para aceptar pacientes antes de este fin de semana. Tenemos que reportar tristemente 14 nuevos fallecimientos en Filadelfia, para un total de 190 personas que han muerto por la COVID-19 en esta área. 93 de esas muertes se han producido en hogares de ancianos. 125 muertes, o el 66% de ellas, se han producido en personas mayores de 70 años. Hay que recordar de que este virus no discrimina por raza o género. El 49% de las muertes se ha producido en comunidades afroamericanas. La tasa de mortalidad es de 1,3 por cada 10.000 habitantes. El 27% se han producido entre personas blancas. La tasa de mortalidad ahí es de 0,8% por 10.000 habitantes. Las pruebas están disponibles, pero están limitadas. Tenemos que cumplir con la medida de permanecer en casa para permanecer sanos y seguros, porque el virus sigue circulando en el ambiente. Si no nos comportamos de una forma diferente a la de antes y no respetamos la orden de permanencia en casa, el virus se propagará rápidamente. Si debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos, usar máscaras de tela en lugares públicos donde sea difícil mantener las medidas de distanciamiento social, especialmente en áreas de transmisión comunitaria significativa, como por ejemplo supermercados o farmacias. Le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponible en 100 idiomas. Si tiene usted preguntas de carácter médico, puede llamar las 24 horas del día, los 7 días por semana, al 1-800-722-7112 y esta llamada es gratuita. Gracias.
Great. Thank you, Armando. And we're going to move now to the Q&A portion for members of the media. Again, I would ask our speakers to join us by activating their audio and unmuting themselves. Remember, of course, we only have limited time for these briefings, so only one representative from each media outlet is permitted, and reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions if time permits. For those logged in, use the raise your hand feature. It can be found under the participants list. We will unmute you one by one to answer your questions, and at that time, if possible, you could also activate your camera. First up today, Annie McCormick of 6 ABC.
Hi, Mike. I have 2 questions. The first one is for the mayor, and talking about the needs from the federal government. Just wondering, since you announced last week that you have to redo the 2020 budget, how much of potential cuts from the city budget could be dependent on what type of help you get from the federal government?
Without being specific, if we don't get enough reimbursement, there will be things we'll have to cut back on. And then we have to determine the priorities and move forward with a new budget based on the information that we will know at the time. Right now, we're still in the process of compiling the costs, the things we think are reimbursable, and also setting up a couple different scenario budgets that may have to be implemented if varying forms of reimbursement either happen or don't happen.
And just as a follow-up on that, are you able to be specific on any of the areas that you think could be potentially cut at this point?
No, that we don't have enough information or enough compilation to determine that. And that'll be, I guess, sometime into the near future.
Okay. And then last question, and just is really for Dr. Farley, and it's more of a clarification. Dr. Farley, you're saying there's good news. We're at or near the peak of the epidemic. Mayor Kenny's saying we're still also at risk for a surge and we need rapid testing and PPEs. I believe that's how I understood it. So I'm just looking for clarification. Dr. Farley, do you feel that the peak could be the surge that the mayor described? And do you think that the FEMA assistance that we had at the Citizens Bank Park testing site is something that may need to be brought back in regards to rapid testing?
You know, both of these can be true. If you look at our case counts, we may be near the top of that, but the surge in demand for healthcare services is going to lag behind that a little bit. And so we're likely to see an increase in that in the future. And then, of course, we don't know exactly what's going to happen beyond that. If people stop paying attention to the stay-at-home order, then we may get renewed infections, and we have to be able to address that. As far as testing goes, right now, the Citizens Bank Park site is just one of many sites across the city that has been available for testing. Our greatest limit has not really been the number of sites. It's been the number of swabs we have for collecting the tests and the turnaround time for the laboratory. It takes 6-7 days to get a result. We're not going to be able to contain this infection over the long term with that kind of turnaround. So if we get more rapid testing, then we're going to want to have more sites across the city, and no one site is going to be able to provide our need. And so I'm hoping we will get rapid testing, and then we'll expand our availability through many other sites across the city.
Thank you. That's all I have.
Great. Thank you, Annie. Next up is Shaira Arias of Telemundo.
¿Se escucha?
Yes.
Hi. My first question is basically, se lo voy a preguntar a Armando en español y después, obviamente. Armando, hemos hablado de la demográfica. Se menciona la comunidad afroamericana, la comunidad anglosajona, en cuanto a los números para la comunidad hispana. ¿Cuántas personas se podría decir que han sido infectados por el COVID-19 o también cuántas personas han fallecido que son hispanas?
First question is in regards to demographic information that has been provided. We've gotten statistics on African Americans and the white population in regards to COVID-19. We would like to know how many Hispanic people in the community have been infected by COVID-19 and how many have died as a result of it.
Yeah, that's a great question. We want to know that answer as well. Our information is very limited, but we're taking the data we have and matching with other databases. When we do, we hope to get information on ethnicity in addition to race. And as soon as I have that information, we'll report it out, but we don't know yet.
Okay. This is a question.
La interpretación de la respuesta, Shaira. Tenemos información limitada y estamos viendo las bases de datos existentes para encajar con los datos que nosotros tenemos y estamos alentando que se registre la etnicidad y la raza de las pacientes y tan pronto como tengamos esa información la vamos a compartir.
Okay, question for Dr. Farley on that answer. Hay una posibilidad de que tal vez la razón por la cual los números no están muy definidos todavía es porque muchas personas hispanas no están haciéndose la prueba posiblemente o no están diciendo que son personas hispanas. ¿A qué se debe de que esos números aún no están disponibles? Esa es la pregunta.
One of the reasons that this information may not be available would it be that it's not defined in the test taking because Hispanics that may be taking the test are not being asked or are not revealing their ethnicity or they're not getting tested enough? And when would we have information on this?
It is possible that if it's not recorded what their ethnicity is, that we would not know that. If people get sick and go to the hospital, we generally get ethnicity data there. So we would have it at that point.
Es posible de que las personas que asisten a tomar la prueba no estén registrando su etnicidad, pero al momento de que ellos están internados en un hospital, ahí sí se registra y cuando tengamos esa información la compartiremos.
And the next question is para la ciudad. Si el departamento de policía, la ciudad en sí, está tomando nuevas medidas para lidiar con el aumento de crimen que se vio más o menos en las últimas 24 horas de tiroteos mortales en Filadelfia.
The next question has to deal with safety and what measures the police may be taking to deal with the increase in crime that has been reported in the last 24 hours and the shootouts and the violence in the city.
Violence is not new in the city, unfortunately. While our overarching crime rates are down, we recognize our violent crime rate is up. Our police department has made sure that every available officer, including officers who are not normally on street duty, are deployed to patrol our streets. And we're working very closely with the department to make sure this violent crime is addressed as aggressively and comprehensively as we can.
And it's been a challenge even before COVID. I mean, we have challenging issues. There's a lot of poverty. There's too many guns in our society. And people now are willing to shoot each other as opposed to either reasoning with each other or fighting with each other in some other way. But this is a struggle that's before the COVID time. And we're continuing to do our best with it.
En respuesta a esa pregunta, Shaira, la violencia desgraciadamente no es algo nuevo para nosotros en la ciudad y pese a que la tasa en general de crimen ha bajado, la tasa de crimen violento ha subido. Y el Departamento de Policía está siendo disponible a todos los oficiales, incluso aquellos que normalmente no patrullan las calles, a que estén emplazados en ellas para tratar de controlar este problema. Y queremos recalcar de que este reto de violencia en la ciudad existe antes del COVID-19 y tiene razones que se encuentran en la pobreza y la disponibilidad de armas demasiado frecuentemente disponibles. Es una lucha que vamos a continuar tratando de ganar.
Thank you, Mayor Brian, and
Thank you,
Dr. Farley. Thanks.
Thank you, Shaira. And next up is Sean Walsh of the Inquirer.
Thanks. Mayor, I believe you mentioned in the beginning of your comments, the beginning of planning for what opening up after social distancing is necessary would look like. What's on the table for you? Like, what are the options of what would that look like in Philadelphia? How would you slowly open the city back up?
Well, first of all, we would follow the medical advice of our public health commissioner. Number one, we would look around the country to see what other cities or states are doing. We would coordinate with the governor's office and our state health officials and try to figure out what makes sense and the most important thing here is that we don't have a resurgence of this. Then sometime in July or August, we're not back with the same numbers, setting up, surge hospitals and getting hotel room space for people in quarantine. And what I worry about is when the numbers are starting to look better and we're getting signals from the national government that they want to move quickly, people start believing that somehow they can stop the social distancing, go out and do what they used to do. And if they do that, we're going to be back in the same situation, potentially the same situation that we're in today. So having these kind of conversations, I think, are important. And it's important to try to kind of game plan what we might do. But if you're looking for specifics before we get additional medical information and data, it's not going to happen.
Got it. Thanks. Dr. Farley, you mentioned, I believe, the racial breakdown with the data available of those who have died. I'm sorry if I missed it, but is there an update on just of total cases for a racial breakdown?
As you know, most of our race data is missing on the cases that report to us because it comes from laboratory reports. We are trying to take that data and match it against other data sets to pick up that missing race information. We're making progress on that. I hope sometime later in the week to be able to give you a much fuller picture of the racial breakdown and ethnicity breakdown for the cases.
Gotcha. Thank you. And Leslie for Brian. On the issue, I know it's not your favorite topic, but of the number of city employees who have tested positive for coronavirus, is the city's position still the same on not releasing that information? And is there any specific department that is struggling with this more than others right now?
So Sean, I think I gave a pretty comprehensive answer to this question last week, and so would certainly refer you back to that answer. And if you need it in writing, I'm pretty sure the communications office can send you something in writing. So no, we haven't changed our posture. And as far as any specific departments who are struggling with this, we haven't seen any deployment levels impacted because of infection rates or sick leave usage.
All right. Thank you, Sean. Next up is Mitch Blocker of NBC 10.
Good afternoon. Dr. Farley, can you tell us how are you using demographic information that you're collecting in order to make decisions?
Well, we always look at demographic information with any epidemic just to try to understand what populations are at greater risk. African Americans that we know are greater risk than whites at this point. Not a huge difference, but an important difference. So we want to make sure that we get our messages out as far as social distancing, particularly in African American populations. We want to make sure that African American populations have plenty of access to healthcare. That's where our focus is right now. As we get more demographic information, we understand things better. We may find other areas that we need to emphasize.
Why do you think that certain zip codes are harder hit by this than others?
I'm not totally convinced that there are big differences by zip codes. As I look at that map, I don't see any clear pattern. It may certainly be just where the virus landed first. I think the main message of the map is that every zip code is affected.
And the last question I have for you, sir, is how will what you are learning from this virus affect public health policy in Philadelphia going forward?
Geez, that's hard to say right now. We're focusing so much on this particular wave of the epidemic. When we get past that, we'll have a better sense of maybe of broader public health issues. I think our next focus, if we feel like we can get past this wave, is what I would call phase 2. How do we get through this period before a vaccine is available, where the virus will still be out there, and we need to prevent it from resurging, but at the same time, we need to be able to make our economy able to work. So that's going to be much of our focus for the next phase.
All right.
Thank you, sir.
Thank you, Mitch. Next up is Shanti Lanz of CBS 3. Shanti.
Hi there. Good afternoon. I have 3 questions. The first one is for the health commissioner. The other 2 are for the mayor. Dr. Tom Farley, this is about the Leah Corris Center, how many healthcare workers will be at that site, and how are they being trained today?
I don't know the answer to either one. I can give you approximate numbers that there were approximately 50 healthcare workers that were going there today for training. Not all of them will be deployed. The hospital is set up to where they can open up in modules, one module of 36 beds. And if 36 beds look like they need to be filled, then they'll open up another group of 36 beds. So the number of workers who would be deployed will depend on how many of those subunits end up being opened up.
Got it. Thank you. Mayor Kenny, on Friday, New Jersey Governor Phil Murphy mandated that New Jersey Transit passengers have to wear face masks while riding. SEPTA, as you know, dropped their policy to mandate wearing face masks after Friday's incident. Do you agree with SEPTA's current position to drop that policy of no longer requiring people to wear the face mask? And are you concerned with the health of essential workers who have to use transit without everyone being protected by wearing face masks?
Well, I'm not sure of the governance scheme of the New Jersey Transit as it relates to the governor, but SEPTA is run by a board. We have 2 members that sit on it, and it's a regional board. It's a regional operation. Do I think everybody personally should be wearing a face mask, whether they're walking on the street or whether they're in a SEPTA vehicle? Yes, but I have not talked to them specifically about the reason for their change. And if Brian or Dr. Farley knows anything they can add, I think everyone should wear face masks when they're out in public.
Shanti.
Okay, and my last question. Yep, I do. There was a fatal fire, and this could go for either the mayor or Brian, I guess. There was a fatal fire this morning in North Philly. 2 kids died. My question regarding that is, with emergency services, what are currently available for families who lose access to their shelter at this time amid the COVID-19 pandemic? How has the city adapted to providing that assistance during this time?
Brian, you want to take it?
Yep. We work very closely with the Red Cross during good times, and we work very closely with the Red Cross during bad times. And certainly, if there are shelter needs, we would turn to our partners at the Red Cross and their house in order to be able to provide temporary shelter. I don't know if that was needed in this case. It's certainly a tragedy to see the loss of life of little kids, despite valiant efforts by our firefighters. And so we certainly give our prayers to that family, and we'll certainly figure out ways that we can support to the best of our ability. But generally, it's on good days and bad days, it's through our partners like the Red Cross.
Thank you.
All right. Thank you, Shanti. Next up is Claudia Lauer of the Associated Press.
Hey, how are you? My question is for Dr. Farley. I just wanted to double check something. It's my only question. When you had said the percentages for the racial breakdown, it doesn't match what's currently on the website. And I wasn't sure if it was in the process of updating before you had announced them, or if the website is not correct yet.
Usually the website is updated after we have these press conferences. So my guess is the website is a little bit behind the numbers I gave you.
Okay. All right. Thank you.
You good, Claudia?
Yes, sir.
Yep. Great. Next up is Pat Loeb of KYW.
Hi, for the mayor or Brian, I guess, what is the dollar figure for lost revenue in the third quarter?
I don't believe, I have to talk with Rob DeBoe, but I don't believe we have those numbers fully fleshed out yet. We can find out and get back to you.
Okay, thanks. And then for Dr. Farley, has the CDC started to offer guidance, or is there any sort of public health consortium beginning to look at how you relax the stay-at-home order without causing a resurgence? I think in other countries they like take temperatures, or they, you put tracking on your phone. Is the U.S. looking at anything like that, to your knowledge?
The CDC has not circulated any guidance about that. We put those restrictions, social distancing restrictions, in place mainly at a state level through the governors. And so it may be that the rollback likewise is done at the state level through governors rather than at the federal level.
Okay, so do you have any theories on how that could be done without causing the surge that you warned about?
Very carefully is the short answer. We're trying to look at what makes sense to do this slowly, gradually, with those things that are least likely to cause a resurgence first, and with many safeguards in place to prevent them from causing a resurgence.
Okay. So no large gatherings for that. That would be the final
no large
step.
Gatherings for a long time.
Okay. Okay. Thank you.
Mike?
Mike Dunn, you are unmuted. You need to unmute.
All right. We had a flawless show until then. Sorry about that. Michaela Winberg of Billy Penn, you're up.
Hey, everyone. I have a question for Dr. Farley. Dr. Farley, you said last week that you had 100 copies of a rapid test that looks for antibodies, and your lab was working to determine their accuracy. I'm wondering if you've made any progress on that, or if you're looking at any other rapid tests.
So to clarify, that was not looking for antibodies. That was a rapid test that would look for the virus itself. But we don't have the results of that parallel testing yet, so I don't know how well that test has performed in our laboratory yet.
Got it. Are you looking for any other types of tests, or waiting on that first?
We are happy to look at any sort of rapid test that can become available to us. This is all we've gotten in our hands so far.
Got it. Thank you.
Mike Dunn, you need to unmute.
All right, I'll get this straight one of these days. We are out of questions at the moment. Does anyone who is in the room have any further questions at this point? And I will go to Annie McCormick of 6ABC.
Mayor, I have one question for you. We just learned that at 2:00 today, Governor Wolf is supposed to talk about discussions with governors from eastern states about reopening. Is that something that you've been privy to? I heard you earlier in the answer to a question about reopening saying that it's going to depend on what other states and cities are doing. And is there any more information that you might have about Philadelphia that maybe announced it too?
It's not going to be what other states and cities say, but we're going to inform ourselves about what other states and cities think. And I have not been privy to the meeting with this meeting of governors, because it's probably with governors. So I'm a mayor. And I want to hear what everyone has to say and more importantly, what the medical people have to say. That's the most important thing. You can talk about economists, you can talk about the president or whoever. I want to know what Dr. Farley and Dr. Farley's peers are saying about opening, not opening, rolling openings, mass gatherings, all those things. We need to be informed by medical and science people and not by anything else.
Okay, thank you. That's it for me.
Thanks, Annie. And Sean Walsh of the Inquirer is back for a second round.
Thanks. Dr. Farley, could you talk about the possibility of antibody testing and, the folks who become immune to it after they recover from the disease? Is that something that we can test for in Philadelphia?
Yeah, over the long term, I'm hopeful that an antibody test will be useful as we get into more of the opening of society to understand who is immune to this infection. Right now, the antibody tests are just becoming available. They haven't been used in enough people for us to really know how to interpret the results. And there are many different antibody tests, and some of them probably better than others. So I think it's going to be a while before we know really how to use those tests. Over the short term, the more important advance is the availability of rapid testing for the virus itself.
And lastly, also for Dr. Farley, if we begin to relax restrictions eventually, or whenever this new phase happens, the one that you were describing, where the economy comes back a little, but the virus is still around. In that phase, do we expect to go back to contact tracing and to identifying the exact people who have it, or will we still be operating on community spread?
I think there are a number of safeguards that we need to have in place before we roll back any restrictions. And one of them would be rapid testing and contact tracing and isolation and quarantine. That whole aspect that I call containment needs to be done so that any case we maximize our opportunities to prevent its spread to other people. We also need to see how we can put in place preventions and protections against for vulnerable populations. Our nursing homes have been hit very hard here. We don't want to have them hit hard in the future. We're looking, how can we try to prevent that if the virus starts spreading in the community again? How can we at least prevent it from being introduced into nursing homes? So those are two of the many safeguards we need to put in place if we really get to talking seriously about rollbacks.
And I'm sorry, I know I said it was the last one, but since you brought it up, on nursing homes, in this phase, it's pretty dire. What can the city do now? Is there anything the city can do now or that local governments can do now to make the situation better for nursing homes?
Well, we're working closely with nursing homes and have tried to prevent its spread. We may have been able to prevent some spread, but there's a lot that we were unable to prevent. I mean, the key really is personal protective equipment for the staff, and personal protective procedures to protect the residents. And we're trying to see if that has broken down, why is it broken down? What can the nursing home do? What can we do in their support to prevent that in the future? It's not an easy question to answer, but we're continuing to ask that question, not just ourselves, but also with the state health department, federal government, and the nursing homes themselves.
Thank you.
All right. And thank you, Sean. And thank you, everyone, for joining us today. That concludes our daily briefing. We will be back again at 1 p.m. tomorrow.